the European Head and Neck Society grew up to a very nice and big community, and it was amazing to meet people from all over the world. So it was not really reduced to Europe, even Japan, some really faraway countries visited to us. And I remember we had a very nice talk about education. This was quite interesting. And people from United States and Europe just discussed what is the best. And you know that the training for head and neck oncology is very different in Europe. We have fellowships, let's say, most expressed in Netherlands, but in other countries they have different ways to educate their people for advanced and comprehensive head and neck surgery and oncology programs. And it was interesting to discuss about that. And it will take some time, I think some years, to get any European standards. But I think the European Head and Neck Society is a good community and society to work for that. So one panel was just dealing with that, and that was very informative and important for us. Another thing is that people from all over the world discussed about standards in head and neck oncology. And it was interesting to listen to people from Armenia, for example, or people from Serbia, or people from Israel, what their institutional tasks are. And there are a lot of things which are common sense, but a lot of other things which are not common sense, which are completely different in their view. We had a big session about quality of care, and it seems to be something not only dealing with quality of life after treatment, it's also dealing with structural things regarding processes. And I remember from Mrs. Schute one presentation which was very impressive, just showing that if you strengthen your workup after first diagnosis and you start with a very strong program and workflow to have people in the hospital to get structured examinations and then to go on with therapy in a short time, that really has impact on overall survival at the end. And this is amazing, because we should really work on that interdisciplinary structural things to strengthen our curricula and workups for patients. Another highly interesting thing was the debate about innovation and artificial intelligence. So there is so much knowledge all over Europe, and it was a great pleasure to listen to that panel with different people from UK, Germany, Denmark, and Netherlands to really get some idea what these people are doing, and to see what's going on in surgery, to see what's going on in radiation oncology. These are all very, very fruitful activities. A little problem in Germany is that we suffer from, let's say, a little bit overdone data safety discussions regarding personal data. And also in this field, there are big differences all over Europe, and we have to overcome that in interest of our patients. So to complete or to sum up, there were so many really new and interesting aspects which really will influence our work. And I'm looking forward to be member and part of this wonderful society to see what's going on in the next years. So that's my short, let's say, most impressive observations I did in Lisbon.